retinopathy. Hypertension can cause damage to the retina of the eye. So what is the major difference between diabetic retinopathy and hypertensive retinopathy? In the fundus picture, the difference is the shape of hemorrhage. Here it is flame-shaped hemorrhage because the hemorrhage is in the nerve fiber layer. And in diabetic retinopathy, it is small microaneurysm and the shape of the hemorrhage is dot blot hemorrhages. Other things are more or less similar. Hard exudate, cotton wool, soft exudate, it is same. And vascular finding is different here. In case of hypertensive retinopathy, vessels are narrowed, nicking of vessels at AV junction, arteriovenous crossing junction. This is normal crossing and this is AV nicking, arteriovenous nicking. Normal crossing means here artery is crossing the vein. This one is artery, sclerosed. This is normal artery, but in case of hypertensive retinopathy, what happens? That artery becomes narrowed, it becomes sclerosed, and it gives pressure on the vein. This is the normal vein. Now here it is giving pressure on the vein. At the crossing, at the junction, it is giving pressure on the vein. And this artery is sclerosed. Grades of hypertensive retinopathy. Grade 1, thickening of arteriole. Grade 2, arteriolar spasm, venous constriction. Grade 3, flame-shaped hemorrhages. Dot blot hemorrhages are there, but not that much. Like in case of diabetic retinopathy, here flame-shaped hemorrhages are more. Then again, ischemia, which shows cotton wool spots, hard exudates, lipid deposits. Those are hard exudates. And grade 4, severe form of hypertensive retinopathy, papilledema, swelling of the optic disc. That is grade 4. See, the vessels are sclerosed. Sclerosed vessels. Flame-shaped hemorrhage, hard exudates, cotton wool spots, papilledema. This is grade 4 hypertensive retinopathy. So, hypertensive retinopathy, you got some idea about it? Causes? Obviously, high BP causes hypertensive retinopathy. High BP which causes vasoconstriction, sclerosis of arteriolar walls, blood-retina barrier is broken. There is ischemia which causes exudation and hemorrhages. That is seen in fundus. Hemorrhages are flame-shaped hemorrhages, exudation of hard exudates, soft exudates, and when fluid is leaked, it is retinal edema. Fundus finding in early stages, generalized arteriolar narrowing, AV crossing changes, AV nicking in case of early hypertensive retinopathy. Moderate changes, copper wiring, arteriolar wall thickening. When the fundus is seen through ophthalmoscope, the wall of the arteriolar wall thickening is seen as copper wiring. When this sclerosis increases, the severe sclerosis shows like silver wiring. Hemorrhages are flame-shaped, as I told you. Then cotton wool spots and hard exudates. Severe malignant hypertension, papilledema, macular star. Hard exudates are present in the macula in star pattern, that is macular star. Then retinal hemorrhages and exudates are in large quantity in this grade. Optic disc swelling known as papilledema. So this is the classification, Keith-Wegener-Barker classification. Grade 1, 2, 3 and 4. These are the key points you should remember. Cotton wool spots mean retinal Ischemia, AV nicking, it is classic hypertensive change. AV nicking is classic for hypertensive retinopathy. Microaneurysm is classic for diabetic retinopathy. So these are the two differentiating points. Papilledema in case of hypertensive retinopathy, but not in diabetic retinopathy. Silver wiring, copper wiring in hypertensive retinopathy, not in diabetic retinopathy. So this is the memory tip: hypertensive retina, narrowing, nicking, silver or copper wiring, then hemorrhages, and last stage is papilledema. Treatment: only control of hypertension and lifestyle modification. Here there is no role of laser, nothing. So just control of hypertension.